Welcome to Virginia Medical Updates. My name is Alejandra Gonsalves, and today's program is brought to you by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine in their practice to complement their expertise in medical care. The areas of focus are in weight management, preventative medicine, and holistic health. Today we have with us Dr. Mahsa Ostovarinia. Thank you for being here with us today.
My pleasure.
Dr. Mahsa is a functional medicine practitioner and a chiropractor at Virginia Family Medicine. She earned her bachelor in biology from George Mason University and went on to complete her doctorate degree in chiropractic care from Life West in Northern California. Her studies led her to mentoring with one of the pioneers in functional medicine, Dr. Kalish, in the Kalish method, which solves many health challenges through specific lab testing, addressing the three key areas of hormones, GI, and detoxification. More recently, Dr. Mahsa proudly served as an active member in Functional Medicine University, International Association of Chiropractors, California's Chiropractic Association, and the League of Chiropractic Women. Also in 2015, she was selected as one of the top worldwide leaders in healthcare in the Silicon Valley. It's an honor to have you with us here today.
Thanks for having me.
And today we're going to be discussing migraine headaches. So tell us exactly how would we know if our headache is actually a migraine?
Yes, migraine headache. Many of us get headache. Right. Unfortunately, migraine headache is a big problem, and it costs millions and billions of dollars in our healthcare system and affect about more than 30 million people in our country.
Okay. If it is an actual migraine.
It is an actual migraine, yes. And the characteristics that you can find out if your headache is a migraine headache or just other types, or it's just very severe. So you cannot just wait, the headache goes away and go back to work. Mm-hmm. You have to do something about it. The other characteristic of your headache, migraine headache, is the type of headache you get. Basically, it's not just achy pain. You feel like a throbbing pain, and the location of your pain is different. It's not like all over your head. It starts from one side. It's a type of unilateral pain. Usually patients get it behind one eye or one side of their head. Okay. So that's another characteristic of migraine headache. Last but not least, it gets worse with activity. So patients with migraine headache, again, they need to rest. They need to close the door in a dark room, no sound. So these are the main characteristics. Okay. While patient with migraine headache, which may last 4 to 72 hours, wow, they get super sensitive to natural light, to normal sounds, and they might get nausea and vomiting in some cases.
So this might be why we see so many patients heading to the hospitals and increasing the costs of healthcare there.
As a matter of fact, that's one of the most common causes that patients end up to emergency room.
Okay, so tell us, are there different types of migraine headaches?
Yes, there are. When you feel like the pain is coming, the aura is showing up, that's a classical type. Okay. And there is a common type, and so many subtypes: vestibular, basilar, ocular, on and on and on. We are not going to get into that. What matters is what is the underlying cause of your headache.
Okay, right, exactly. So it's something that you would have to hopefully follow up with your doctor and see what may be causing it. But what would you recommend, something that we could do that could help get rid of these migraine headaches?
Yes, that's the time that functional medicine comes in place. Okay. So functional medicine is medicine by cause. It's not medicine by symptom. So we have to find out what is causing, what is triggering the symptoms in order to find and fix the problem.
Right, okay.
There are many factors that can contribute to migraine headaches.
So some detective work has to be done.
Exactly. Okay. And guess what? After all, your migraine headache might not all be on your head. There are 10 patients, for example, if they all have same symptoms with headache, migraine headache, mm-hmm, they might have a different cause. And so we have to figure out what is triggering their symptoms, and then by finding the root cause, we can address their problem and help them out.
Okay, so what would be a way that we could find out what exactly is causing
There are so
migraines?
many factors that contributing to triggering their problem. They might be low in vitamin B deficient, so they might be low in vitamin B. They might be having some hormonal imbalances.
Okay.
Their melatonin, one of the hormones that helps you to wake up and sleep, has a cycle of your sleep pattern basically. It might be low or high, so it's imbalance in melatonin. Sometimes you have food triggers, you have allergy to some foods. You can have gluten sensitivity. There is a protein in wheat, rye, and barley, oat. You might be allergic to it. So there are different factors. Sometimes you have problem in your first and second bone of your neck, so the nerves that going to your neck is not functioning properly.
Okay, so of course, as you mentioned, finding out what is actually causing these migraine headaches to occur. You mentioned the foods. How could somebody find out if a food or an allergy would be causing these migraine headaches?
That's a good question. There are so many tests out there that you can check your food sensitivity, but the best and convenient one is doing elimination diet. Elimination diet, basically, you just remove a specific type of food like dairy, nut, or egg.
So just one at a time?
One at a time.
Okay.
And then wait for a while. If your symptoms went away, so that's a sign. It might be that food. Wait, and if you're feeling good, just add that specific food to your diet again. If you get worse and you feel bad again, just it's that type of food.
And how long would you recommend for your patients to wait to go without that specific type of food?
It takes about 3 weeks normally. Depends on the age, weight, and the type of food.
Okay.
General 3 weeks.
3 weeks to go without it, and then if that doesn't cause any migraines, move on to the next group that you might try.
Exactly.
Okay, I see. So what about any other types of levels of, maybe you mentioned vitamin B12, any other types of elements that could be causing these migraines?
Actually, it's vitamin B2, riboflavin.
Okay.
It's one of the vitamins that you definitely need to check with your family
B2.
physician.
Okay.
They can check, find out if you're low in it. Or magnesium.
Okay.
It's one of the other minerals that it's very crucial to have it in balance and in check. It's very easy by blood test or just find out what is.
So would your level of magnesium be elevated or low?
It's low.
Okay, and that would be causing the migraine headaches as well. Is this something that could be, if it is low, medication or supplement that somebody would take?
Yes, when you feel like you have cramping, muscle cramping, or fibromyalgia, some type of symptoms like that, you're definitely low in magnesium. But definitely there are good supplements. Just consult with your practitioners. They can recommend the best quality supplements to make sure that you are in a normal functional level.
Okay, okay. And then as a chiropractor, are there any types of procedures that can be done to help with migraine headaches?
Yes, there are so many techniques that can help to align the first and second bone. Let me show you what I am talking about
great.
here.
Great.
All right.
Handy dandy spine here.
Here you go. That's our spine. This is the first bone, atlas, that's holding your skull, your head, and this is the second bone. In most cases, your skull holding your brain, and your brainstem is here. So in most cases, when these two bones are misaligned, so the fluid, the blood, nerve, all these components that passing through this area are not functioning because of the inflammation that's happening due to rotation of one of these bones. If you have car accident, if you had a long dental surgery, or you had a
wear and
sport
tear,
injury,
maybe? Okay.
exactly, can damage these areas. And as a result, many patients get migraine headache. There are specialized chiropractors, they called upper cervical chiropractor, and so they can manage and align those two bones and make sure they're functioning properly, non-invasively. Even kids get that treatment done. We adjust, and it's pretty safe, and they can get back to normal without having recurrent of migraine headaches.
Okay, and how soon would they see any results from having that alignment?
Mostly the next day or two.
Oh wow, okay. And is there decrease altogether of the migraine headaches, or they would just maybe see
The frequency,
they would be gone, or?
sometimes, yes, sometimes the frequency drops by 80%.
Wow.
All depends on the case and chronicity of the condition. Absolutely.
Okay, okay. And any types of, you mentioned, again, going back to the foods, it would be just be something that we would have to see individually. There's not a specific food that you could say, you know, I don't know, something with more salt that could be causing migraine headaches, or a specific type that we should avoid. There
is always, we take a long history before we recommend anything to patients and run specific exams to make sure every individual is different. So we have to, as a detective, we have to dig in, find out the root cause, and it's an individual-based medicine. Okay. So functional medicine, we have to just focus on every individual based on their history and their symptoms.
Right, okay, and so hopefully that would help decrease sending everyone to the, or patients going directly to the hospital, either getting these alignments or you know, checking their levels to see if that magnesium level isn't too low. Would you recommend having a daily supplement?
Yes,
magnesium?
There are daily supplements that patients should take, vitamin B2, magnesium, but it's all based on patient's age, weight, and other medications that they are taking. So everything should be safe and in a normal range.
Okay, so of course, as you mentioned, with functional medicine, you have to have it individualized for your own treatment. So
exactly.
Thank you again for discussing this important topic, Dr. Mahsa.
Thanks for having me.
Of course, it was great to have you with us. And thank you again for joining us here at Virginia Medical Updates. My name is Alejandra Gonsalves, and we hope to see you next time.